Good morning, everyone. So, I think a lot about drugs, obviously, and I think right now about the cultural moment that we're in and the attitudes, the perceptions that we have as individuals in society, uh, apart from drug laws, apart from our own personal biases and experiences. I have a question. What role do I play in improving outcomes for people who use drugs in our society? And that's a pretty big and broad question because drugs is a loaded word and a broad word that encompasses a lot of different substances, from medicines to ones that we have very divisive opinions on whether they should even exist, let's say, in our societies. So, baseline reality set us up. Drugs are not going away. They are not an anomaly. They are not something that we can enforce out of our societies. They are part of the human story. And they've been used across time for many reasons, medical purposes, in grief and reflection, in cultural and emotional healing, in spiritual exploration, in mind exploration, in the purposes of pleasure, maybe what we're most familiar with in our modern culture, recreational use, cultural celebrational use, but equally so, and importantly of note, coping with pain, trauma, and survival. So, a key idea here is not whether drugs are a part of our societies, they are. It's how do we relate to them. And this word relate is really, really critical. It's one I want to focus on. I want us to think about drugs as something that we have a personal relationship with. That relationship might not exist, i.e., you may not use cocaine, and so you don't have a relationship with that substance. But that is equally as important as the substances that you do have a relationship with. Why? Because I think it's critical that we think about these things. And we've come from a time in history, through the drug war, through a lot of propaganda, through a lot of narratives that have confused our understanding about substances and their place in our society, that we haven't spent time thinking about our own personal relationship with these substances. So, I think that we've been primarily in binary thinking. Drugs are bad. You're either in addiction or you're not. You're either in recovery or you're not. You're either clean or dirty. And a reality about what we know about substance use, what we know about people who use substances across time, is that most drug use is not problematic. It doesn't create problems for the individual who uses them. And so, yes, addiction is real, but it's not the only story. And so part of what I hope to do, what I aim to do in my work and through sharing of my own personal story is to expand the narrative, to go into to build nuance in our comprehension, in our understanding, and to realize that oversimplified narratives like drugs are bad or addiction is a moral failure or that we just need to enforce our way out of this or sloganeering like 3 strikes and you're out and this kind of stuff doesn't solve problems. In fact, it shuts down the conversation, so we actually can't help the people in our lives who need to be connected to help. And that's a real problem. So, when I think about an average Canadian, maybe someone close to my age or older, and how they would have absorbed an understanding about substances through their lifetime, it would be a series of conflicting narratives, fear-based propaganda, mixed signals in pop culture. We tend to go between two very, very polarizing extremes. Drugs destroy lives. And then this other narrative, addiction deserves empathy. But then the mainstream way of glorifying substance use, making it look like it's just a ton of fun, and we do this primarily with one particular drug, and we all know that is alcohol. And that's a drug we play a very insidious and hypocritical game with in our society. We pretend it's not a drug. More on that later. So there is historical context for drug use. There is cultural context for drug use. Psychoactive substances have been used for centuries, in particularly, connected to ritual, connected to drugs like psychedelics, ayahuasca, peyote. Opium is a historically long used substance. There's really fascinating kind of idea or suggestion, speculation that the Enlightenment was actually spurred forward by the proliferation of caffeine. So prior to that time in the 1500s, early 1600s, there was notable amount of alcohol consumption in daily life, low alcohol by volume in terms of percentage, strength, potency, but consumed for hydration and to deal with impure water. And then all of a sudden we see this emergence of caffeine and soon after followed by the Enlightenment. And it's like the productivity and senses and cognition of the human mind were dulled by years and years of alcohol consumption. And then we introduce a stimulant to the culture, and suddenly thought explodes and creative thinking, and it's an interesting idea and fascinating to play with, and just shows that substances are part of culture, part of history, part of our societies, and it's not all bad. And I think we need to get away from the edges a little bit when we're having conversations about this topic, realizing that drugs destroy some people's lives. At least it would appear that way on the surface if we don't really dig in to try and understand what is underneath that experience for an individual. If we drive down the east end of Vancouver and we see people on the sides of the street that are clearly struggling, and without knowing, we just assume that drugs are part of that narrative. We'd be right in almost every case. And then we assume that this is the destiny of people who use drugs. That is a narrative in our culture, that if you use a drug when you're young, maybe it's cannabis, maybe it's alcohol, but now you're on that slippery slope towards destruction. And we kind of have that embedded in maybe the back of our mind. It's been programmed into us through media and TV movies that we've seen, but it's obviously not true. We think of our own experiences with substances. For most of us have tried some drugs, both legal and illegal ones. Most people experiment at some point in their younger years, and I'm going to guess that the vast majority of people watching this have not become homeless, have not ended up imprisoned, have not completely destroyed their lives or ruined relationships with their substance use. And so, I have a question about culture and where we're headed, how we're thinking about substances and treating them today, because it seems we have drifted far, far away from the ritual and meaning and context that we often historically had wrapped around substance use. And instead, we've replaced it with shame, with punishment, with disconnection, with isolation. And the evidence of that shift in the way we treat substances is apparent in the culture around us. I think we live in a cultural moment in which the ideas, the values of the society, the things that we find meaningful, the things that we're in pursuit of, the individualism of the American dream perhaps has landed us here in this moment where we live in a world that actually exacerbates the harms of drugs and increases the propensity, likelihood of addiction for the individuals within the culture. If scientists were doing some science in a lab, I'm not a scientist, so I'll get some of the language wrong here, but they say they want to grow something a healthy something and they put it in a culture, right? It's in a culture, and if that thing they're trying to grow is not doing well, some of them are aborting, they're developing cancers, they're not living long or growing or developing in the way that the scientists will hope. Then they would say it's probably because they are in a toxic culture, right? It's not directing blame on the organism, on the individual. It's recognizing that perhaps they're within a culture that's very, very toxic, and we're all within that culture. Maybe we all have some role to play within that culture about the way we think about substances, the way we think about drugs, the way we think about people who use drugs. Because very often we associate our judgment towards a substance. We have a very bad feeling. We have no positive regard for crack cocaine, perhaps. But we project that disdain also onto the person who uses it. That stigma, lands on that person in a way that prevents them from seeking social support. This was my experience. This was my story in a very dramatic way that I felt driven to very aggressively hide my drug use, to keep it as secret as possible, right? And that's because we all intuitively know that drug users are bad people. Well, no, we don't intuitively know this. This has been programmed into us. I like to ask audiences, where are my drug users at? Who uses drugs? Put your hand up. And people don't, or a few people do, or their hands are very low, kind of like, cautious and tentative. Or there's a random guy at the back of the room holds up his cup of coffee and, yeah, I like my drugs, my caffeine every morning, and he's very proud of that, as I do too. But the point is to show that people are hesitant, of course, to admit and open up about their drug use. They wouldn't dare. If this was the 1980s and I asked that question in a room, people would be like looking around, wondering where the undercover officers are waiting to arrest them, because admission of drug use was, admission of criminality. You should be imprisoned, right? So, and then I'll ask an audience, who uses alcohol? Who's willing to admit that they consume alcohol? And many, many more hands, of course, go up. And the vast majority of these people, if we ask them, would say that their alcohol use they feel is responsible. It's under control. It's not problematic. It's not an addiction. And so we know that that's the case for most people. Research shows about 85% of substance use is problem-free. That means it's this 10 to 15% or so of the population that do develop a problem with drugs that we really need to direct resources and services towards helping. But I'll point out to the audiences that lifted their hands up and said that they consume alcohol that, as I've already said today, alcohol is a drug, which means all those who consume alcohol are drug users. And I've been in pubs consuming beer with people who tell me they don't use drugs. So there is a hypocritical layer here within society that we need to talk about. And it's attached to stigma because of the way we've associated drug use of certain drugs with people and with people groups. So for you, if you're a person who consumes alcohol and you've not really thought about this before, maybe just say to yourself for a moment, I am a drug user. And then sit with that thought or that feeling. What feeling comes up? How does that sit with you? What does that do inside you? And for many, it's uncomfortable. It's not something you want to broadcast. You've not thought about your identity as being one that is a drug user. And so that's, why is that uncomfortable? Well, that's the stigma that's embedded in our society that not only, thinks about the behavior and that perhaps there's problem or harm in the behavior, and we can talk about that, but more so that the person is flawed inherently, that you are a bad person because Your coping strategy is a drug that society sees as particularly insidious. And there are a lot of coping strategies that are especially harmful for people, but that society does not judge in the same ways. And when we think about what an addiction experience is like for people, has a lot of common themes, then we realize that for actually the vast majority of adults, they have had an addiction experience in their lifetime, something that they would say was maybe substance related or not, but provided temporary relief, provided pleasure, and was therefore at some point along the way craved, but in the long term caused harm. And yet the person was unable or is unable to give it up. This is a definition from Dr. Gabor Mate, who talks often about trauma and the hidden drivers underneath addiction. And I think for far too long, we have thought that drugs were the primary culprit here. And we haven't paid nearly enough attention to the the psychosocial, the whole person. What is going on in their social environment? What was that person's childhood like? What traumatic pain have they experienced and maybe not known how to deal with, or had anyone to help them walk through that with? What neglect, what lack of love, lack of support, lack of attention did they have or not have in their lifetime? These are the things that we need to be much more curious about. As Gabor Mate says, it is not why the addiction, but why the pain. So just returning to a core question here, what is your role? What is my role in society thinking about these substances? Now that we've reframed drug use as complex, it's not inherently bad, that addiction is not a moral failure, that virtually all humans use substances or coping behaviors, of course, in some form. If we have this understanding now, we need to cast a vision for a healthier society, a society that is not exacerbating the harms of drugs and increasing the likelihood of addiction, but a society in which we don't shame people for their choice, but rather support them. We don't shame people for the struggle, we support them. We don't offer fear and propaganda like we've done for the last 75 years with drugs, but instead we offer pragmatic, honest education. We replace condemnation with care. Right? We meet a struggling person not with criminality and in prison, but with compassion, with curiosity, where healing will become more accessible than just exacerbating the harm. What am I talking about? I'm talking about harm reduction, a very pragmatic principle that all humans who engage in risky behavior, which is all of us, abide by and intuitively understand that if we're going to do something that has risk, if my loved one is going to do something that has risk attached to it, I want to minimize the harm. So I'm not describing or dreaming of a utopia or a drug-free world or a world in which every person knows how to use drugs responsibly and we've normalized drug use, but I am dreaming of a world in which perspective shifts to one that builds hope for the individuals who struggle the most and creates compassion along the journey, realizing that for those who do struggle with an addiction, it's an incremental process of recovery that is filled with ups and downs, which might include relapses and returning to the substance. And we want them to stay alive. We want them to have hope. We want them to have a dream for the future. And the only way that's going to happen is if we don't further disconnect them from people in their lives who have hope and a dream for them. So thanks for bearing with my thoughts today, and I'm very curious about the response to this and where we go as a society and as individuals in building a better world and being more caring for people who do use drugs. Thanks.